Can vertigo go away on its own? The better question might be, how long are you willing to wait for it to go away? We'll get into this and decide on whether you need to do something now or you can wait it out. Welcome to the Vertigo Recovery Channel. I'm Dr. Kevin Smith. I want to help you not only figure out what's causing your vertigo, but how you can recover from it. The best way to get my help is to hit that subscribe button and that little bell next to it to get notifications on when I come out with new videos. So, to talk about this question of whether or not vertigo is going to go away on its own, you got to look at what might be causing your vertigo. You can check out my free ebook through the link in my About page or down below on the 5 most common causes of vertigo and how to recover. And that'll give you a little bit more insight into what might be causing it. But let's take BPPV. So BPPV, it's a very mechanical issue. Those little crystals get loose in the inner ear, and whenever you change positions, they're causing dizziness. Now, this is something that 90% of the time I fix in one visit with my patients, and it's definitely something that can go away on its own, but you could be waiting weeks, months. I've had people that even up to a year, they've had BPPV. And this is something that can be fixed so quickly. I really encourage people to go get it fixed if you're not able to do it online. And not wait for this, because it'll increase your risk of falling when you are getting dizziness. It'll increase your risk of developing some kind of chronic problem, such as 3PD or changes in the brain that might have you processing information differently, and that can lead to dizziness down the road. It can also cause balance issues. And the longer that you leave it there, the more likely or the higher risk you have of it reoccurring again. So I saw a study that said that if you were able to fix BPPV within the first 24 hours of having it, which not a whole lot of people are able to, but if you can, you have a lower risk of reoccurrence. So I highly recommend that you don't wait this condition out because it's such an easy fix. Definitely get it taken care of. So another condition, vestibular neuritis, inflammation of the nerve of the inner ear, is often caused by a viral or bacterial infection. Now, the first kind of onset, that acute phase, that constant vertigo, usually it's a spinning sensation that's going to last hours to even days, that will often go away, subside, and then you're just kind of left with this dizziness with quick head movements, as well as balance issues. Now, that first acute phase will go away on its own, but the dizziness with quick head turns and the balance issue, it can go away. But again, I recommend you do vestibular exercises, because the longer that you leave it, and the more likely you are to develop more chronic problems and maybe other issues on top of it. So you can, for BPP, easy fix, vestibular neuritis, vestibular physical therapy is very effective for treating both those issues, the dizziness with the quick head turns and the balance issues. So there's no need to sit around to wait for it to go away, because you can treat this with exercises. So I definitely recommend for those two problems that you do something about it. Now, if you're looking at some kind of condition like 3PD, which is persistent postural perceptual dizziness, or cervicogenic dizziness, usually these issues are more, or they come on after another vestibular problem. So if you have a vestibular neuritis, sometimes that can lead into 3PD, or even cervicogenic dizziness. You can have things overlapping. Now, when it's a problem that's kind of developed from another problem, it's less likely to just go away on its own. Oftentimes, it just kind of gets worse. So 3PD is definitely something that we treat with vestibular physical therapy, and we have good results with that one, and as well as cervicogenic dizziness. So make sure that you are getting those two issues taken care of. And the other two that I would say is like vestibular migraines and Meniere's disease. Those are less likely to go away on their own, unless, if it's migraines cause from hormonal changes. Maybe you exit that kind of phase of life and they do eventually go on the way away on their own. Some people have migraines so infrequently that doesn't really affect their day-to-day activities, but a lot of people have them that affects them, several times a month or even several times a week or even on a daily basis. And those are people that are going to be, much more affected by it, and you're going to have to look at what might be triggering your vestibular migraines. So you look at lifestyle factors like stress, diet, lack of sleep, dehydration, all these different lifestyle factors, what might be triggering your symptoms to try and help decrease the occurrence of them. And then for Meniere's disease, a lot of times it can be involved from diet as well. But for both those issues, you're going to end up with a lot of times like visual motion sensitivity or just balance issues, and all those issues that kind of come with those problems can be treated with vestibular exercises as well. So there's not a whole lot of things besides things that might require surgery, like a vestibular schwannoma, a tumor on the vestibular nerve, or perilymphatic fistula, or a semicircular canal dehiscence that might require surgery to fix. There's a lot of the diagnoses that are causing vertigo you can treat. I recommend not leaving it, not prolonging it, because it can develop into something more. Now, if you're trying to figure out what's causing your vertigo, check out my video on the 5 most common causes of vertigo, and figure this out. Don't wait to treat your vertigo, because it could could turn into something bigger. If you have any questions, please feel free to reach out. And again, I hope this was helpful for you.